what is happening? We're going to get right into it. This is for the hips to teach them how to rotate. Your ball and socket joints, your hips and shoulders, if they can't rotate, they do not have that much range of motion overall and are going to cause a lot of problems. This one is just 3 exercises, and all you're going to need is the floor and a little bit of your time. So I'm going to take you through just 1 round, and then you can rewind the video to do up to 3 total rounds on your own. All right? So we're going to be in this 90-90 position for the first exercise, and all of the exercises actually. So 90-90 position, you want to get your front leg to about a 90-degree angle. It does not have to be exactly 90 degrees, okay? This first exercise, the more you lean away from your front leg, the easier this gets. The more upright you are, the harder this gets. So if this is new to you, or if you have some glaring issues, a lot of pain, you're going to want to lean onto your forearm. Your other foot, you can do whatever you want with it. I usually end up putting it up like this. So this first exercise is called an external rotation liftoff. You're going to push the knee into the floor as you lift the foot up as high as you can. We're going to hold that for 5 seconds, come down, and then as soon as the foot touches, we come right back up. What we're trying to work are these groin muscles here, okay? So here we go. We're going to do 10 repetitions. Push the knee into the floor, lift up, 5, 4, 3, 2, 1, and back down, right back up. 5, 4, 3, 2, 1, and back down. 5, 4, 3, 2, 1. 5. This whole time you're lifting the foot up as high as you can. And back down. 5, 4, 3, 2, 1. We're halfway there. You should be feeling a pretty good burn in that groin by now. 4, 3, 2, 1. Back down. 5, 4, 3, 2, 1. Back down. 4, 3, and back down. 2 more. Ooh, I've done these a bunch of times and they still burn. Woo! Last one. 5, 4, 3, 2, 1, and back down. Okay, just to keep this simple, we're just going to go to the other side and do the same thing. So switch. Leg is roughly at 90 degrees. Now, if it were me, notice how high I was lifting up. If you're lifting your foot up pretty high, you might be able to get away with being a little more upright and making this a little more challenging. So just something to consider. Set your back foot wherever you'd like. Again, you're pushing the knee into the floor as you lift the foot up as high as you can. Ready? First rep. 5, 4, 3, 2, 1, and back down. Right back up. 5, 4, 3, 2, 1, 5, 4, 3. That's 3. We're just going to go right into the next rep. 3, 4. Again, trying to feel this in the high groin area for the most part. Halfway there. 5, 4. Okay. 2, 7. 5, 4, 3, 2, 8. 5, 4, 3, 2, 9. Last one. 5, 4, 3, 2, and 10. Good job. Okay, to keep this setup as simple as possible, you're actually going to stay right here, keeping this leg the front leg. Now we're going to do what's called a piriformis push-up. This is for the butt cheek of the front leg. You want to think about 2 things. Having a nice tall spine, so we don't want to hunch over. And then as we fold forward, you don't want to think about folding down. You want to think about pushing the chest forward. Feel that stretch in the glute, and then come back up. You can start with some hand assistance. Eventually, as you get stronger, you take one hand away, and then eventually doing no hands. Again, if this is new to you, you're going to want to use both hands. So nice tall spine, push the chest forward, feel for the stretch in that butt cheek, hold it for just a second, and then come back up. We're just going to do 5 of these. So that's 1. Okay? Here we go. That's 2. Again, I'm thinking about reaching the chest forward each time. 3. 4, and 5. Before you switch, we're going to do an exercise with the back leg. So I'm going to turn 90 degrees so you can see this a little easier. Now with this one, we're trying to work the back pocket area by lifting the knee up as high as you can and then bringing it back down, okay? We're going to do 5 of these as well. So bring the knee up, feel for that contraction in the butt cheek, and then come back down. We're going to do 5. I don't know if I said that or not, but 2, 3, 4, and 5. Good. Okay, now we're going to switch sides. So your back leg becomes your front leg becomes your back leg. All right, same sequence. Nice tall spine. Push the chest forward. Feel for the stretch in the butt cheek. And then come back up. 5 reps. 1, 2. If I'm feeling particularly tight on one side more than the other, I'm going to hold that stretch for a few extra seconds. There's never anything wrong with that. 3, 4, and 5. Okay, feeling a nice stretch in the glute there. I'm going to turn again. You can stay where you're at. So same thing with the back leg. Again, we're trying to feel that back pocket of the glute area. That's what we're trying to work. So brace yourself with your hands. Bring the knee up until you feel that contraction. And then back down. If you're cramping, probably a little late to mention this now, but try to contract through it. Try to breathe through it. Obviously, if you absolutely have to get out of the position, feel free to do that. But by breathing and contracting through it, you're actually overcoming the imbalance that's causing that cramp. 3. Takes time, but it can happen. It will happen. 4. And 5. Good. Okay, so that is one set. Like I said, it's anywhere between 1 to 3 sets is what I want you to do. The hardest part about dual mobility is being more consistent with it, but that's the only way you'll actually notice a difference. So my best advice to you is to set a reminder during a time of day where you're most likely going to have 10 minutes to do this. So that could be, before work, that could be on a lunch break, that could be while you're watching TV at night, but set an alarm and commit to doing 1 set as a minimum. Now you may be thinking 1 set's not going to do very much, and maybe it is, maybe it isn't, but think about it this way, a couple things. Number 1, if you're doing 0 sets, then doing 1 set a day is 7 sets a week, almost 30 sets a month. You can't tell me that's not going to have a positive difference on your mobility. And then the other thing too is a lot of times this is a little subconscious trick. You're just telling yourself, just do 1 set and then you don't have to do any more. But then as you're doing that first set, a lot of times you start to feel good and then bam, you blast through 3 sets in 10 minutes and you've done all 3 sets. Okay, so set an alarm for a time of day that you're most likely to be able to do this and commit to just doing 1 set at a time as a minimum. And I promise you, whether it's lower back, hip, groin, knee issues, whatever you got going on, this circuit will help tremendously. Please share this with a friend and I'll see you for the next video.